The top 10 questions I'm asked regarding laser tattoo removal. Hi, I'm Dr. Messina, and when I started Dr. Undo Tattoo in 2005, I noticed that there were the same 10 or 15 questions that I was asked over and over again. So I've decided to make a list of the top 10 questions in order of importance, and we're going to discuss them today. Number 10, is laser tattoo removal really appropriate for me? Well, the answer is, in the vast majority of people, laser tattoo removal, when done properly, and when done properly is the key words here, are the most predictable and reliable method of removing your tattoo with the least risk of creating a scar or disfigurement. It's very important, though, to know what type of colors you're dealing with, what type of lasers you're dealing with, and the type of skin you're dealing with. There are certain patients who are just not appropriate for laser tattoo removal. People who form a lot of keloids, people who are on Accutane, and certain immune disorders. But for the vast majority of people, laser tattoo removal, it might not be the fastest method, but it is the most predictable method. Number 9, is it going to hurt as much as everyone says? Unfortunately, yes. Now, if you look at YouTube videos, you're going to see people screaming and jumping off the table. It doesn't have to be that. Plus, pain is subjective. What's excruciating to one might be very tolerable to another. It has to hurt. If somebody tells you, my laser tattoo removal process doesn't hurt, they're either lying to you or using effluence or laser energy that's too low to cause any fracturing of the ink and the dermis below. You see, all the pain comes from the shattering of the ink and the minor rupture of the dermis below that, plus ripping open any scars that might be in the area. There are a lot of things we could do, though, to blunt this pain. Simple things such as an ice pack help. Topical creams like BLT creams and nerve blocks. I prefer to do sub-Q injections of lidocaine. I found that an area of about 3x5 index card is about as big as I want to go with lidocaine injections, and lidocaine injections will block all of the pain, but there's a dose involved. That's why I said greater than 3x5, you're spreading it out too much to really work. I drink and smoke. Is it really going to ruin my laser tattoo removal process? The answer is no. They're not going to have any clinically significant difference. When you smoke, you decrease blood flow and therefore oxygen to a tissue. So yeah, you're probably decreasing the immune response in that area. But are you going to notice it? No. So compared to someone who's not smoking, is it going to change significantly? Nope. Same type thing with alcohol. Although alcohol might actually increase the blood flow to the tissue from vasodilation. But again, are you going to speed up your process appreciably? No. Now, if you do drink and smoke, maybe it would be helpful to reduce it and even stop it during your laser tattoo removal procedure. That will just be another big plus for you for your overall health. But drinking and smoking will really not affect your laser tattoo removal process that much. Can I shower the night I have my laser tattoo removal? Yeah, you actually can. Here's what I tell my patients. Gently wipe the area with suds and water and rinse it off. Don't take out a loofah and start working on it. Don't take out a big sponge and start scrubbing it. Your body's going to do all that work. As far as the temperature goes, keep it tepid, about 100 degrees. If it's too hot, it's going to sting like crazy and you'll know not to do that. But yep, you could shower the day you get your laser tattoo removal. What about swimming? Here on Long Island, we have 2 good months to use the pools. What I tell people is, if it's your own pool and it's crystal clear and you know it's well cared for, by all means, you could swim after you have your laser tattoo removal procedure. Going into the ocean, I don't recommend that. The salt water is going to change your fluid dynamics, and it's probably not going to be the healthiest thing for your tattoo. Plus, going out in the open sunshine, that area that was lasered is slightly more sun sensitive now. So you want to be careful about exposing it to the sun, or even worse, getting a sunburn on it. As far as jacuzzis go and hot tubs, no, do not use them after laser tattoo removal. Jacuzzis and hot tubs are notoriously filled with bacteria, and you don't want that bacteria in there. So don't use a jacuzzi for those first few days that you have your laser tattoo removal done. Is it true that if I get a tan, it's going to be really bad? Yes. Here's why. We're not so much concerned about creating a burn. The lasers for tattoo removal don't throw out a lot of heat. Now, if you're having hair removal and you get tan, yeah, you can get a burn. What we're worrying about is getting the skin darker than it was under its natural state. The lasers used for tattoo removal seek a pigment and shatter it. It's not going to say, wait a second, here's the tattoo. Oh, and this is just some tan skin. Let's leave that alone. It's going to work to shatter the melanocyte, which makes you melanin, which gives you your skin color. If you stun the melanocyte, it's going to become slightly hypopigmented, and when the melanocyte recovers, you'll get your pigment back. If you kill the melanocyte, you're going to get a white area that's probably going to stay permanently. Therefore, you should not get tan during the course of your laser tattoo removal process. Now, over the years, I had 2 professional surfers. They had to go in the sun all the time. It was amazing. In the summer, they were on the East Coast. In the winter, they were in Cambodia. It seemed like they never got out of the water and they never got out of the sun. What they did is they put sleeves on or a patch on the area. That helped a lot. I never had either of them have any trouble with their tattoo removal. So if you really want to worship the sun, cover the tattoo just for that one summer. Will I blister? Big question. Blistering is very common in tattoo removal. Sometimes it's related to the laser. For instance, a Q-switched ruby laser that I use for greens and blues tends to blister even at the lowest of energies. It's just part of the physics of how that laser works. Sometimes blisters can come from using too much laser energy or fluids, and then you create a big traumatic blister. But it is somewhat unpredictable. Some people never blister, and some people blister the first few times. When you blister, you could blister in a few ways. The lucky people blister as tiny little blebs. The unlucky ones will make blisters the size of plums. If you have a big blister, you can pop it if you want. Try to do it as sterilely as possible. It's going to absorb or pop on its own anyhow. Once it does, leave the skin alone. It's going to form like a little scab. Keep it clean and use bacitracin and neosporin, provided you're not allergic, just for a few days until it heals. And it heals very well. But it's very important not to pick at it. So yeah, blistering can occur. Doesn't always mean that something wrong was done. But you have to care for it once you blister, because now you're going to have an open epidermis, which you didn't have under normal conditions. Question number 3. Will the laser scar me? Big question asked by everyone. I don't expect to see scar formation. Scar formation, when it's done properly, is less than 5%. Usually if I see somebody come in and tell me they went somewhere and had a laser tattoo removal procedure, did I form a scar? It's almost always one of 2 scenarios. Either the wrong laser entirely, such as a long pulsed millisecond firing laser for hair removal, or an IPL machine, or the right laser, except at way too high affluence or laser energy for that tissue to tolerate. What happens is, in the beginning, when you have a lot of ink, you need less laser energy. There's plenty of pigment for that laser to pick up on. So you use a lower energy. If you use the energy that you would be using at, let's say, session number 6, you run the risk of rupturing the ink and rupturing the epidermis, and that's how you can make a scar. So I tell my patients I don't anticipate scar formation. Number 2, will my tattoo be removed completely? This is a great question, again, asked by everybody. And it's a question that irks me like you will not believe, because I came from a critical care background. I was accustomed to giving a treatment and knowing I was going to see some result in the very near future. With tattoo removal, it's a little different. We don't know what's in that ink. If that ink has titanium in there, or an oil base, or even a plastic in there, those things make it very hard to remove. And sometimes you don't notice that until you've gotten into it a little while. 4, 5, 6 treatments, and then you have this ghost of a tattoo that doesn't want to go anywhere, or it starts sparking as you laser it because there's metallic particles remaining in the dermis. So you can't tell. In general, if it's a standard ink and you start treating it and you get significant reduction in your ink volume in that first, second, third treatment, then the odds of that tattoo coming off clean, where you don't see any residual, is pretty good. If you have a light skin and a black tattoo, that's about your best shot. If you have light colored skin and a shaded tattoo, black shaded tattoos, then you really have a good chance because you don't have a tremendous ink load. So unfortunately, I can never tell anybody with 100% certainty that their tattoo is going to come out so completely that they'll never know it's there. Question number 1, how many sessions is it going to take to remove my tattoo? This is a really difficult question to answer and asked again by everyone. Dr. William Kirby on the West Coast, the dermatologist, did a study in 1999, and he took into account a lot of variables from skin type to ink load to the colors of ink, and he made the Kirby-Desi score, which gives us a pretty good estimate of the number of treatments it's going to take to remove your tattoo. Unfortunately, it can't take into account how your immune system is going to respond or how your skin is going to respond. It could very well be that your skin is very sensitive to the laser. Then we have to change some of the parameters around, which in turn is going to alter the number of treatments. So it's very hard to say. The average tattoo probably takes about 10 treatments. It depends where it's located. A head and neck tattoo comes off with a few less treatments than a tattoo on the torso. A tattoo on the torso comes off in a few less treatments than a tattoo on the lower belly. A tattoo on the lower belly comes off with a few less treatments than a tattoo on a hand or a foot. And the finger and toe are the worst. I tell my patients, expect 14 sessions to remove these tiny little finger tattoos. The blood and the lymph flow just isn't that great, therefore it's a slower process. I hoped this video answered a lot of your common questions before you start, or even if you just started your laser tattoo removal procedure. The best thing I could tell you now is to be patient. 6 weeks in between treatments at the bare minimum if you're a Caucasian patient, 12 weeks if you're African American, and give it time and have patience. That's the best method to have a clean, beautiful laser tattoo removal process. I hope you learned something. If you did like this and you like this type of material, give me a thumbs up, hit the bell, click subscribe, and I'll see you at my next video.